Hello, dear viewers. Welcome to the program Health Navigator with the first international interview. Our guest today is Dr. Jeffrey Long, an oncologist, radiologist, writer, and author of the book Evidence of the Afterlife from the USA. Dr. Long is already familiar with ALLATRA International Volunteer Movement. He took part in 2 conferences of the Creative Society Project, the conference Life After Death, Fictions and Facts, and recent one, Global Crisis, This Already Affects Everyone, as well as in the roundtables dedicated to these conferences. Hello, Dr. Long.
Hello, everybody. So it's a pleasure to be here and talking with you once again. We've got some important, significant information to talk about here today.
We're very pleased to have you here for interview with us and to find out your opinion on the issue which are very interesting for our viewers.
Dr. Long, as your professional side, we know that you studied the cancer over 35 years. And we have got the first question for you. It's very interesting to get to know from your side that cancer is one of the leading causes of death in the world, with estimated 19.3 million new cases of cancer and almost 10 million deaths from cancer in 2020. What the increase in cancer incidence is associated with, and what are the main causes of this disease in humans?
That's a great question. By far, the biggest cause of cancer worldwide is smoking cigarettes. Unfortunately, that causes a very significant, really high percentage of lung cancers in the upper aerodigestive tract, esophagus cancer, and also bladder cancer. Literally millions of people contract cancer every year as a direct result of smoking. Alcohol is also a significant contributing factor to alcohol. And then just simply an unhealthy lifestyle, excess weight, eating junk food, basically. All of these, excess exposure to the sun, these are all things that contribute to different types of cancer.
Could you tell us, please, are there any ways to prevent the cancer? What can a person do not to get sick?
And some fairly simple steps that you need to take. Certainly, most importantly, avoid smoking. And you really don't want to be around people that are smoking heavily too. That's called secondhand or passive smoking, and that also causes cancer. You certainly want to minimize your alcohol intake, because that can be associated with cancer, again, in the upper aerodigestive tract. It's important to eat healthy foods. Fresh fruits and vegetables are certainly always healthy. Have a diet, just a normal diet that's not high in processed sugar. That can certainly reduce your risk of cancer in the intestinal tract. If everybody followed optimally healthy eating and reducing their environmental exposures, you could probably cut down the number of cancer cases in the world by perhaps half or more.
And also, we have one more interesting question that, we learn about ecological poverty from the conference Global Crisis. This already affects everyone. And there was comparison with the patient in intensive care. Is there any connection between the state of the environment, for example, like food quality, and the development of the cancer?
Absolutely. The environment is very important. We're very concerned about cities that have a lot of air pollution. There's no question these people are not only going to have a higher risk of cancer, but they're going to have a higher risk of problems, often serious lung problems and heart disease and a whole host of other things. So again, just all part of a healthy environment, all contributes not only to reducing your risk of cancer, but keeping you healthy overall.
That in the book, Sensei of Shambhala, Book 1, by Anastasia Novych, there is such a quote. With the healthy thoughts, there is a sound spirit. And with the sound spirit, there is a healthy body. Do you think our negative thoughts can lead to cancer?
Yeah, that's an interesting thing. I think there's no doubt about it that people that are chronically depressed, and shoot, we all know these kind of people. They're always looking at the negative. They're always looking at the worst possible outcomes. They worry a lot, they fret. I think there's no question that stress can affect your immune system. And a healthy immune system is necessary to help fight cancer, as well as a whole host of other medical maladies. So once again, very important to try to keep a healthy mindset. I mean, there's so much positive in the world. It's easy to just focus on that and say, there's so much good, there's so much positive that we encounter in our daily lives. If you keep thinking about that, focusing on the positive, try to reduce negative emotions. Once again, you're not only going to live a healthier, happier life, but that's going to radiate to the people around you. I mean, this is literally a part of a creative society, is to be healthy, both in mind and body, both healthy mentally and spiritually. Keeping that sort of global view of health is going to help you not only prevent cancer, but live your life as well as you possibly can. Those fairly simple tips.
What new methods of cancer treatment exist today? Are there any positive results?
The news about the latest developments treating cancer is exceptional. With our modern technology that we have available today, we're curing way more cancers than were ever possible in the past. For example, children, pediatric cancer, we now can cure about 80% of them, whereas over 30 years ago, it was less than half of them were being cured. But adults too, and mainly their developments in the cancer modalities that we already had. There were improvements in radiation therapy, my medical specialty. It is amazing how we can drop that radiation right on the cancer with tremendous sparing of surrounding tissue, much better than we could even 5 to 7 years ago. Surgery is getting better year by year. They're more able to identify the area that needs surgery and do that with less morbidity, more ability for patients to get home quickly, not have to stay in the hospital as long, more effective than ever before. And certainly as far as cancer treatment, amazing developments in the systemic treatment. There's a new generation of cancer treatment called immunotherapy. Immunotherapy basically uses the body's immune system to attack the cancer cells, and it can attack it with an effectiveness that's simply amazing. When we started using immunotherapy a few years ago, all of us treating cancer patients were amazed. Here were people that should have died like years ago, and all of a sudden here they were living months, years longer than we'd ever seen before in our lives, cancer-free or cancer under control. So dramatic improvements in our ability to control cancer, certainly a large amount of research going. So I think we're going to have even better tools at our disposal to fight cancer in the future than we even do today.
The next question, as of course you know, and you've been participated and speaker on July 21st, 2021 at the conference Global Crisis. This already affects everyone. Questions were raised on artificial intelligence. So we're going to switch to and go through this topic. That examples of the introduction of artificial intelligence into medicine, do you already know in your practice? Could you share the examples? And do you think it is really important now to develop technology in medicine?
Artificial intelligence is revolutionizing pretty much all aspects of medicine. For example, in my medical specialty of radiation oncology, the use of radiation to treat cancer, we have computer algorithms that are beyond anything that was even possible a few years ago. These computer algorithms can allow us to, if you will, optimize our delivery of radiation therapy to fight cancer. It is astounding to me how these algorithms, basically intelligent algorithms, allow us to drop a dose of radiation right on the cancer. We know where the surrounding normal healthy tissue is. These algorithms make sure that to the greatest extent possible, we keep the radiation away from healthy normal tissues. That cuts down both the side effects of cancer treatment as well as this long risk for complications. And that's been absolutely revolutionary in radiation therapy. Again, we're curing far more people than we ever could before with far less side effects. For example, these algorithms in treating prostate cancer, one of the most common cancers, have gotten so powerful that when I coach patients now about their prostate cancer being treated with radiation therapy, I tell them, look, our ability to drop that radiation dose on the prostate with a little tiny 5 to 6 millimeter margin around it is so good that about a third of you patients that get this treatment will have no side effects at all during treatment. And that's just amazing. Here we are curing a very high percentage of people, but because of the power of artificial intelligence and that support that we have today already with the patients we treat, we can cure patients with that very high probability with remarkably very few and even no side effects of treatment.
Thank you. And now we are going to watch the video from the conference about artificial intelligence, and we will see even more, examples what you said and more what implemented all over the world already, and what kind of can be many ways to use artificial intelligence in medicine. So let's watch this video.
Robots have been working in the leading medical clinics of the world for almost 30 years. Not only do they compete with specialists, but they can replace them fully. 100% accuracy is what we expect when we have been diagnosed or we are being prepped for a surgery. This is the precision that AI technologies are demonstrating in healthcare today. Robot nurses can already fully take over all the functions of middle grade and junior medical staff. They even outperform people. They are accurate and efficient 24 hours a day. One of the most common and complex procedures performed by a nurse is blood collection from the vein. According to statistics, nurses have difficulty collecting blood in 30 to 60 patients out of 100. Repeated insertion of needles may cause injuries and inflammation of the veins, even worse, thrombosis. A robot will never miss the vein because its sensors clearly see the wall of the vessels in the infrared spectrum. Machines already obtain medical licenses, which means they can officially work as doctors. A Chinese diagnostic robot named Xiao Yi passed the National Medical Licensing Exam and was authorized to treat people. It scored 96 points higher than required to pass the exam, exceeding the skills of human candidates. Today, artificial intelligence successfully replaces specialists not only in diagnostics and therapy, but also in surgical specialties. Robots themselves choose the most effective and sparing plan of surgery for a particular patient and perform its main stages. The use of AI in surgery allows to significantly reduce the time of a surgery, for example, on the brain, from 10 to 12 hours to 2 to 3. Remove tumors with micron-level accuracy, minimize blood loss, risk of infection, and complications. One robot can replace a whole team of doctors and has the experience of thousands of the best specialists put into it by its developers. Surgeries performed by an AI guarantee a quick recovery and a short post-operative period. For example, today, doctors can save lives of people who are hundreds of miles away by remotely controlling the work of a robot. Ryan Matter, a cardiologist from Michigan, conducts percutaneous coronary intervention. It is a life-saving technique for a person in the state of acute myocardial infarction or sudden cardiac death. One standard procedure is performed by a team of 4 doctors and takes 1 hour on average. The use of AI allowed one doctor to save the lives of 36 patients in a few hours. The universal surgical robot Da Vinci performs operations on any organs. In America alone, almost 80% of cancer operations are performed using this robot. The number of operations in the world with the help of Da Vinci is approaching 2 million. The robotic systems have been installed in the USA, Israel, Germany, South Korea, Japan, Ukraine, Singapore, Russia, and other countries. The American surgical robot STAR has surpassed Da Vinci. This is the first robot that can autonomously perform soft tissue operations. This type of surgery is the most difficult for robotics to master. Incising and suturing soft tissue were the only things surgeons still had to do in robot-assisted surgeries. STAR solves that too. Today, doctors assist artificial intelligence. Millions of people around the world are waiting for an organ transplant. In China alone, there are 1.5 million people on the waiting list, while in the United States, 20 people die every day not being able to receive a donor transplant. In Russia, there were only 900 donors for 6 million people in 2017. Millions of people, including children, are dying around the world. And this is the terrible reality of today's consumerist society that does not value human life. The technology that could save the lives of these people is 3D organ printing. Transplantations of corneas, skin, bladder, and pancreas are already being performed nowadays. The question is, why aren't these technologies being implemented on a mass scale? We're introducing technologies to destroy each other, but we are in no rush to make public those which save human lives. Consumer format of society is not about saving lives. Attention! Even more efficient and accessible technology, nanorobots are 1,000,000 times smaller than ants. They affect the body at an atomic and molecular level. They perform microsurgical operations with high precision, remove blood clots, close wounds, perform fast and cheap diagnostics of diseases on the cellular and molecular levels, and efficiently deliver drugs to hard-reach areas of the body. Nanorobots can rearrange the same cell to cure cancer or grow a new leg to replace prosthesis. They simply assemble it from the molecules around them. They are also able to assemble their own copy, that is, they can propagate. Nanorobots can both restore and destroy the human body. It depends on the specific program they receive. Imagine, you just drink a glass of ordinary water, and there are doctors, nanorobots in it, which you will not even feel. And consider that you have visited a diagnostician, a therapist, and a surgeon of the highest qualification at once. Since moving around your body, they will not only diagnose you painlessly and unmistakably, finding the cause of inflammation, but they will also eliminate it and completely restore the functions of your body. The cost of making these nanomedics is only a few cents, and it takes only a couple of minutes to assemble. And it's an alternative to any doctor who takes years and enormous amounts of money to train. So, there are already more than enough technologies capable of replacing any medical specialties as effectively as possible. And they are rapidly developing. But, in the conditions of the consumer format of society, the use of these technologies will lead to the fact that people who were saving our lives yesterday, today will be left without work and without means of livelihood. Now, technology has a chance to change the world. But what that change will be is up to you and me, friends.
Dear Dr. Long, we now just watched the video, and also, we discussed the pluses and the benefits of artificial intelligence, and we watched many benefits in the video, like what happened all over the world. And what is interesting now to get to know from your point of view, what are the risks of implementing AI in the medicine you could see from your side, from the doctor's side? Do you see what kind of risks do you see of implementing AI in the medicine?
Yeah, and that's an important question too. Artificial intelligence has got breakthroughs in all aspects of medicine that we haven't even thought about yet. There's things in the future that are going to help diagnosis, treatment, in keeping people healthy, recommendations for that optimal health, preventive medicine, certainly, things that we haven't even thought of. Now, as exciting as that is, I think, and as part of a creative society, we need to think about how that can affect everybody in the world. It's simply wrong to have that technology that can help people so profoundly confined to a very limited part of the world's population. I think it should be an important part for everybody to work with their governments, with the people that are making the artificial intelligence, to work to the greatest extent possible to make sure that this amazing benefit of artificial intelligence in healthcare benefits everybody. Everybody in the world is important. Everybody in the world deserves the best possible medical care. Literally, their health and life depends on it. We get a healthier population throughout the whole world, it's going to be a better planet. There's going to be less war. There's going to be, that's going to help reduce poverty around the world. I mean, the impact of insisting that this type of healthcare from artificial intelligence is benefiting everyone will have enormous benefits, literally for people all around the world, even in the countries that are higher socioeconomic and certainly in those lower socioeconomic. So I think that's a very important part of focus for artificial intelligence. Make sure its power to keep people healthy is worldwide available.
How do you see medicine in a creative society?
Creative society means everybody has the same opportunity. So absolutely, the highest powered artificial intelligence, and of course I strongly encourage continued development in artificial intelligence, but I think we also need to develop that not only with the motive of profit, but with the motive to help people wherever on the world they are. People that are anywhere on the world get sick with the same illnesses, the same diseases pretty much as other people around the world. So using artificial intelligence and making sure that it benefits everybody, I think is a critical part of the creative society, that equal opportunity wherever you are to live your life as healthy and happy as possible.
And maybe at the end of our interview, could you tell us some small tips how to be healthy?
Sure. There's certainly as a doctor, I've got some tips to be healthy. We talked earlier about some of the big killers, tobacco use, alcohol use. You can cut that out of your life and you're going to live a lot healthier.
Dr. Long, there is an interesting question that about the cancer, right? That, as you mentioned, as we know, really the alcohol, the cigarettes, the smoking and everything can really develop and born like cancer. But there is an interesting question. So why small kids who are not smoking, not drinking alcohol, but also they can get the cancer? What are the reasons could be for them, so that even, they don't drink alcohol and they don't smoke, of course, like the small kids, I mean, right? But they have got the cancer. What could you share and say in this case?
Tragically, you can get cancer even when you're a child. On rare occasions, kids have even been born having cancer. And the reason for that is, of course, not due to smoking or alcohol or environmental exposure like adults are often have, but it's predominantly genetic. Each one of our each one of our body's normal cells has what's called DNA. That DNA is the part of our normal cells that results in the cell functioning normally. And it takes, on average, about 7 strategic damaged areas on a strand of DNA before it becomes a cancer cell. So typically with children, it's common that there's a genetic predisposition to have genetic damage that results in them getting cancer at such a young age. more mysterious than known even today. And we don't have a clear understanding about why all these genetic hits occur on our normal cells and result in cancer. Well, it's been a real pleasure to talk with everybody about this very important topic. Encourage everybody now more than ever to stay healthy, enjoy life, and certainly encourage those around you to do the same.
That's really important. Thank you.
This was another fantastic interview. And this is really, once again, this is literally going to make the world healthier and help save lives. So a huge thanks to everybody. And I know you've got a big group there. This is really making a difference, and I'm really honored and feel privileged to be a part of this important outreach that you all are doing. So thank you too.
Dr. Long, thank you for this meeting, for sharing your professional experience and your personal position on important human issues that are more and more relevant today than ever with us.
Friends, the project Creative Society on the IPM ALLATRA platform unites the entire planet in one goal, creating a world in which all people live a prosperous, safe, peaceful, and happy life. Because absolutely every person is important in a creative society. If you share this desire with us, join the Creative Society project on the allatraunites.com and inform your friends that today we have a real opportunity to radically change our world for the better, and the implementation of this goal depends only on our choice. We also invite you to the international online conference Global Crisis Time for the Truth, which will take place on December 4 this year within the framework of Creative Society project.
Thank you, and see you at the next program of Health Navigator.